Hello everyone. Now we are going to another chapter of the Cancer Prevention Seminar. Chapter number 15, Myths and Truths about Cancer. What are the truths, what are the untruths that we have about cancer? You know, many people talk about cancer and many people have different ideas, so this is our opinions. This is what we are going to discuss today. I'm going to start with one of my stories. Many years ago, we have a girl that came to my office. Her name was Cindy. And then she was 10 years old and had a small nodule in her chest. And then when I checked the nodule, because I used to do small surgeries to take warts and cysts from the chest, so that's something that I used to do. But for this, it was a little deep and kind of rigid, and looks like have some roots inside. I told her, this is not for me. We need to refer her to a surgeon. The surgeon made the diagnostic, operate her. It was a lymphoma, non-Hodgkin lymphoma. And then surgery was performed at the São Paulo Adventist Hospital on that time. And everything was okay. But lymphoma, this type of lymphoma in children is very complicated. So we don't expect that the final result will be good. But a couple of days after the surgery, her mother came back to my office and asked me for a diet. The doctor didn't mention anything about diet, so please, Dr. Dos Santos, can you give us some instructions? Then I told her, okay, let's do a diet with fruits and vegetables. Maybe for 1 week we will do a detox diet and then eat a lot of papaya because it has carotene. That is good, is one of the things on that time that I thought was good for cancer. And then after that you follow a vegetarian diet, a total vegetarian diet, what we call a vegan diet, without any animal product. That was my prescription for cancer and still is today. And then she did. She ate a lot of papaya, and then she felt well during those days. And then later on, she returned to the surgeon for a follow-up. The surgeon was a friend of mine. Until that time, he was a friend of mine. And the surgeon asked her mother what kind of treatment she was doing. And then the mother said, well, I am following Dr. Dos Santos' vegetarian diet. And then he smiled and said, no, I'm not talking about diets or herbal teas. I'm talking about what treatment with the oncologist. What type of chemotherapy are you doing? Have you visited the cancer specialist as I told you to go? And then she said she hadn't been to the oncologist. Somehow she didn't get the message that she should do anything else for the girl. So we are not doing any treatment, she said. The doctor was upset, and then he told the mother, you must take Cindy right away to São Paulo Cancer Institute. This is not a disease to treat with diet of fruits and papaya. She needs chemotherapy. You can imagine how bad I was from that time on with this doctor. I mean, I believe this doctor really didn't like me because another patient that I sent to him was an AIDS patient, and then was a very high risk of contamination on that time for a surgery. And now I send this lady with daughter with a lymphoma, and I am trying to keep treatment with vegetarian food. So I don't know if I have talked to that doctor from that time on. But the lady brought Cindy to the AC Camargo Cancer Center in São Paulo. It was, on that time, one of the biggest cancer center for treatments on the area. The oncologist examined Cindy and checked the pathology reports, and then he asked the mother, what kind of chemotherapy is Cindy doing? And then the mother said, no, only following a vegetarian diet given by Dr. Dos Santos. She really, the doctor smiled, and then she was really trying to put me in jail on that time, because they might say, okay, I mean, you have cancer, and then you are giving a quackery treatment for this girl. That's not good. Who is this guy, by the way? Then he asked about that. Who is this Dr. Dos Santos? Who is this quacker guy? And well, I have to be very careful. I never indicate that a person should follow a diet and forgo or refuse to take any chemotherapy. I have nothing to do with the treatment of cancer. I give a diet and I tell them, hey, you follow whatever your doctor says. Don't give up on your doctor, and don't do something that later on you are gonna repent. So, but the guy want to know who is this Dr. Dos Santos. But he kept looking at the Cindy's report, that the pathology report, and he look and look and look and look, and then after checking the pathology for a long time, he looked at Cindy and then told her mother, Cindy has a very serious type of cancer, and the treatment that we have for this is not going to help at all. So whatever diet she is following, whatever treatment is she on, keep it on. It looks like it is working. And what happened to Cindy is that for more than 15 years, she has been free of cancer. She did the surgery, removed the tumor, and then she did a vegan diet and a detox diet. That was the her only secret. Can diet cure cancer? Well, there is no studies that prove that. Only evidences about prevention. My advice is do a better diet, do a healthy diet, but use the diet that the research says is effective to prevent cancer. As we have had information enough on diet, and we will have in the next chapters of this seminar, we will summarize the best diet for cancer. So use this type of diet in terms of prevention. However, diet does not substitute treatment. It is complementary. That means that surgery, radiotherapy, chemotherapy, or immunotherapy, or cryotherapy, or other types of treatments for the disease have to continue. But some people will say, well, you do a natural treatment together with these treatments is very bad because they don't match. In fact, I'm going to show you in the end that many times some of the foods and some of herbals might even help the patient to recover from chemotherapy, or even to respond to chemotherapy better. So let's start about talking about myths about cancer. First, about what people think that causes cancer. This is the joke for the day. The guy is saying that the true cause of cancer are those electrical lines because of the magnetism that they provide and that they release in the atmosphere. And the guy is smoking a cigarette and ignoring totally the effect of cigarette. I remember I was one time in a lecture about herbals and cancer in Brazil. Yes, there is something like that. I mean, they are showing that there are some herbals that have some substances that activate the immune system. The problem is that the doctor that was presenting the lecture was smoking. It was an indoor auditorium, and the guy was smoking almost one cigarette after another. And then later on, when we asked him about this smoking, he said that he didn't believe that smoking was a cause of cancer. That was enough for me. And then we asked him, what do you think is the cause of cancer then? Well, I believe it depends on the genetics, it depends on the personality, stress, and emotions and things like that. So I'm not afraid of cancer. And say, okay, that's too much for me, and that's too much for our seminar here, because we based on the truth that the main cancer substance that we have around is tobacco smoking, is cigarettes. So there's not doubts about that across all scientific fields. Can a cell phone cause cancer? Until now, there is no evidence of association between cell phone and cancer in most studies. The thing is that brain cancer is a very rare type of cancer that is not increasing. We would say that if brain cancer is caused by cell phone use, it would be the main cause of cancer today. Would be the main cancer that we have around, but is still very rare. So this is one point. The other point is that there is no association with the side where people most use the cell with the type of cancer or the side where they have tumors. And then neither with the time spent on calls. So the studies are not showing much things on that. The other problem is that there is there is no mechanism. The International Agency for Research on Cancer, that is Department of the World Health Organization, has recently classified radio frequency fields as possibly carcinogenic to humans, based on limited evidence from human studies. Limited evidence from studies of radio frequency energy and cancer in rodents, and there is no mechanism for that. As I mentioned, the cancer is relatively rare, and mortality rates have not increased. In the United States, we have 22,340 new diagnoses and 13,110 deaths from brain cancer in 2011. And this has been stable in the years after. The other problem with the absence of a mechanism is also very important, because the radiation that comes from a cellular phone is not enough to cause a mutation in brain cells. It's just a heat. And heat not always, it has to be very high heat to produce mutations. So in that case, the heat produced by the waves from a cell phone is not enough to produce it, and will not alter the DNA and will not cause a cell to become cancer cells. Exposure to ionizing radiation, like X-ray, for instance, or radiation therapy, is known to increase the risk of cancer. However, although many studies have examined the potential health effects of non-ionizing radiation from radar, microwave, and other sources, there is currently no consistent evidence that this non-ionizing radiation can increase the cancer risk. But if you don't believe on that, reserve the use of cell phones for shorter conversations or for times when a landline phone is not available. And use those hands-free devices, which place more distance between the phone and the head of the user. So, can magnetic fields cause cancer? So those electric lines or haircut or hairstyle devices, hair dryers, computers, TV, electric blankets, there is no connection with cancer until now, neither in adults nor children. So we have one of the studies was done in Long Island, and they were trying to see if they have a connection between the electric lines and breast cancer, but the result didn't get any relationship. But we know, and pay attention to that watching TV can cause cancer. Would that be because the TV waves, TV radiation, or computer radiation? What do you think? In fact, watching TV, electronics, video games, and computer are, by other mechanisms, sedentary activities which increase the risk of obesity. Aha! When you increase the risk of obesity, you increase the risk of breast cancer, ovary, uterus, prostate, colorectal, pancreas, and kidney cancer. So you see, it's not because of the waves, but because of the weight. When I was studying public health, doing the master in public health in Loma Linda, many of the professors showed, when we have epidemiology class, a relationship that they found between breast cancer and TV sales, proving that many times the statistics or ecological studies can show something, but in fact, this was an artifact. The cause of the increase was, by chance, was related to TV sales, but nothing to do with TV in terms of a mechanism. But nowadays, we can tell them that, in fact, breast cancer could be related to more TV. Don't you think so? Based on the mechanism that I just described. That when you have more TV, you watch more TV, you have more risk of obesity. Now let's go and talk about treatments. What treatments, I will comment in some treatments that people say, or some doctors or even not doctors, non-doctors are promoting to cure cancers. There is a lot of people that claim that they can cure cancer, but let's check what we know about that. One of the most common that I got, that I heard from my patients was shark cartilage. But they didn't find any effect of shark cartilage on cancer treatment. Well, this is a cartilage. Cartilage is connective tissue, and similar to bone. I mean, it does not have much substance there, or even a mechanism that could explain its effect on cancer treatment. A research from the Anderson Cancer Center in Texas, one of the biggest cancer centers in the world, didn't find any benefits for lung cancer. In June 2005, a publication in the journal Cancer also showed no positive results in breast cancer or colorectal cancer. So there is no mechanism, there is no evidence from studies, so I would say you can use because there is no side effect, but don't put your faith on that. It's just too good for those that sell the cartilage. Laetrile. Laetrile is a substance that is inside of the apricot seed, and then it contains amygdalins. However, it contains cyanide too. It might be anti-cancer, but it's toxic. The results are inconsistent, and they don't indicate. Some results say that it is good, some results say that it's not good, and is not proven to be effective, and can cause poisoning. So be careful when you do that. I don't advise this type of thing. Gerson's therapy. Gerson's therapy is one of the therapy that was being done in the United States. I believe now they moved to Mexico. They use a vegetarian diet. They use, I used to practice this when I was working in Brazil, and we give a lot of fresh food, fruit juice per day to the patients. We gave some vitamin and mineral supplements, and they have to do enema or blisters, or cleansing of the intestine, and then they use flaxseed also. There is no evidence that this kind of treatment is efficient against cancer in general. Most of the patients for this treatment, they come with stage 4. You know, stage 4 is when the cancer is metastatic. So it's spread around the body, and the chances to recover are very minimal. And then what happened is that the guys from the Gerson's therapy, they had some success with 1 or 2 cases, and then having a success with 1 or 2 cases is kind of a success, because it's not easy to deal with patients in stage 4, and there is no treatment that could revert a disease in that stage. So I might give some credit to those, but I don't know if they will give the treatment before in stages, initial stages, if the treatment would be successful. In any case, what I like about the Gerson's therapy is the diet that is a vegetarian diet. My cousin, and now we have another story. My cousin had a kidney cancer that was inoperable. And this is a picture, but this is not the real picture of him. So if you know this guy, it's not my cousin there. He was 24 years old. He went to Gerson's therapy. He came from Brazil and to the United States, and then with the Gerson's therapy, it looks like he was able to do a surgery, and then he recovered. However, I have done that in Brazil. I used to work in the Clínica Adventista Vida Natural, and we had several patients with Gerson's therapy, and also all of them with stage 4. I don't remember which stage was my cousin, but those patients that we had in stage 4, I believe all of them died, as I can remember. You can visit the Clínica Adventista Vida Natural in Brazil. It's a beautiful place. We used to do a lot of cancer therapy, but I believe now they just do a general detox that is good for everyone, and it's a good place for stress. It's a good place for losing weight, and they are still open and offering this type of natural treatments. They have a lot of herbal teas, they have a vegetarian diet, vegan diet, and they have a lot of hydrotherapy. Plus exercise and an environment, they have their own organic food. So it's a good place in Brazil. If you want to know more information, go to www.vidanatural.org.br. Can supplements and vitamins help cancer? High doses of vitamins did not help on cancer treatment. There are not enough studies to confirm, and vitamins can help when there is malnourishment. But in general, they don't have any effect according to studies that are being done. Beta-carotene in pills can increase the risk of lung cancer. We already mentioned that when we studied lung cancer. But it looks like beta-carotene and other antioxidants in food seem to decrease the risk of cancer. Remember, I gave papaya to Cindy when we start talking about the story here. And papaya is rich in beta-carotene. And probably it was one of the substances that helped to control her cancer. But when a person takes a pill, beta-carotene pill, there is no result, and in the case of lung cancer, increase the risk. So not a good idea to use a pill. There is a rare risk of cancer with malnourishment. Malnutrition or lack of foods rich in some vitamins can increase the risk of cancer. And you can understand that very easy. All of these vitamins, vitamin A, riboflavin, vitamin B12, folic acid, vitamin C, iron, selenium. We mentioned selenium, that is important for the prevention of, if I am not wrong, is pancreas cancer, and zinc, and vitamin A that and vitamin D that is now in the news all the time. All of these vitamins are important for the immune system. So if you have a deficiency in these vitamins, you will have a low immune system. That is one of the armies that we have internal that can combat cancer cells. But not necessarily you have to take vitamins to have vitamin in pills to have those support of vitamins. With the exception of vitamin B12 for those that are strict vegetarians, and vitamin A and vitamin D for those that don't take enough sun, you don't need much of those supplements. Severe malnourishment can impair DNA, so this is for sure. Now let's talk about the truth about cancer. Some vitamins might be good for cancer, like calcium supplements can protect against colorectal cancer. But the problem is that they might be related to prostate cancer somehow. So you should be avoiding that. Selenium, as I mentioned, protects against prostate cancer. And vitamin D can protect against breast, prostate, and colon cancer. All of these are not very known studies that are still being developed. I would put a little bit of doubt on the real effect of this, and we need more time and more studies to confirm those effects. We know that regular exercise and weight management can reduce the risk of breast cancer and probably colon cancer and all the cancers related to obesity. We already talked about that. And I already mentioned this slide that is by Dr. Blair, very old slide, but in his study he found that the ones that are doing high activities, both for men and women, the risk of cancer is more, the risk of mortality or the rate of mortality is very low compared to those that are more sedentary. Diets that can cause cancer. Disease that can cause cancer. So there are some diseases that are related to cancer, like chronic inflammation, Barrett's esophagus, ulcerative colitis, HIV, AIDS, obesity, as we mentioned in our slides, and organ transplants. Some of these diseases, the cancer cause is the treatment, like in organ transplants and in chronic inflammation. It might be not the disease itself. Foods, specific foods can be related to cancer, like garlic, that decrease the risk of stomach cancer. And then we have to say a joke. We always have jokes in this course. They invented a new children's food, half orange juice and half garlic juice. Therefore, the baby grows healthy and it is easy to find him at night because of the smell. Cabbage. Cabbage belongs to the family of the cruciferous, as we are going to mention in the next slide. Brussels sprouts and red cabbage increase the GST, which protects against bladder cancer. So this is another thing that is important for us to know, that there are some advantages in foods that are from the cruciferous family. If someone has a genetic alteration with a lower level of GSTM1, the risk of cancer in the lungs increased. The cruciferous vegetables, cabbage included and Brussels sprouts, have properties to fix that genetic alteration. That's why we have to use more of those. I believe we talk a little more about, I believe we already talked about the cruciferous vegetables, but those are the family of vegetables that are from the cabbage, spinach, lettuce, cauliflower, and Brussels sprouts. There is some individual suspicion that blueberries can suppress cancer cells. Cherries increase the apoptosis. Remember the cancer suicide, the cancer cell suicide, and then mostly related to colorectal and leukemia. Pomegranate is probably effective against cancer cells in the prostate. Onions are probably effective on colorectal cancer prevention. Mushrooms, mostly the shiitake mushroom, there is some evidence against breast and lung cancer. And even the acai, that is a fruit from a palm tree from Brazil, can have cancer cell suppression properties. So all of these things are healthy, and all of these things might not be proved that they are effective, but they have at least mechanisms. There is the old version of antioxidant, and then they use the ORAC to measure the antioxidant capacity of foods. And then those are the main ones that are considered effective against free radicals. There is a theory that free radicals that can come from the pollution, from the environment, or from the whole body metabolism when you start to making excreting the toxins or the residues of food and from the body, that the free radicals are produced or are introduced in the body. So this substance could neutralize them. You see in the top of the list we have prunes and raisins and blueberries. All the small and dark fruits are very good and antioxidants. In this list you have two main sources. You have the black fruits, small black fruits, and dark green leaves like kale and spinach and Brussels sprouts and broccoli. So we advise that you use more of this substance. At least once a day you use one component that has very high antioxidant measure. I create this name antiodons when I do my lectures on anti-aging, because I believe those are the main substances that we should be consuming, that should be in our kitchen. There is also evidence that in some herbal teas have also a powerful antioxidant effect. The terpenoids are helping to activate the GST, that is glutathione S-transferase, that is a very powerful antioxidant, and then make the carcinogens more soluble in water and then easier to eliminate from the body. Where we have terpenoids? We have terpenoids in, I would say there are several types of terpenoids like carvone, geraniol, famazole, limonene, menthol, perennial, and alpha-pinene. And those are found in herbals, like seasonings, like caraway, spearmint, and dill, lemongrass, coriander, melissa, and then citrus, mints, cardamom, cherries, spearmint, angelica. All of these are herbals that we use in the kitchen. It looks like what we use in the kitchen is something richer than just the flavor that they give. There is something interesting about lemongrass. I like to promote lemongrass because I thought lemongrass was from Brazil and originary from Brazil. And then when I went to China, I worked in China for 6 years, and then I figured out that lemongrass was originary from China and probably was exported from China by the Portuguese or the Spaniards and took to Brazil and taken to Brazil. And then because it's very popular in south of Brazil. The only difference that in south of Brazil or in Brazil we use the tea made with lemongrass. In China and in Asia they use lemongrass in the soup. They don't drink the tea. And I was able to introduce in Hong Kong for the first time lemongrass tea for the population in Hong Kong in my seminars, and they love it. It was very interesting that I went there. I used to work there between 2001 until 2007. And then I went back in 2014, I mean 7 years after that. And when I went to the place that I used to do my seminars in the Bible Auditorium Church in Hong Kong, they prepare again for me the lemongrass tea. So they learn how to make it and they love it. And so I am famous to introduce lemongrass that is originary from China to the Chinese in the form of tea. But it's just a joke, okay? Here you have the lemongrass leaves. Is a very thin leaf and a very, if you smash it, it's very smelly, but you have to be careful because you can have a leaf cut. Yeah? It's not a paper cut, but is similar to a paper cut because the leaves are very sharp. So other herbals that can be having properties anti-cancer are the garlic, licorice, carrots, flaxseed, peppermint, oregano, basil, rosemary, turmeric, sage, and tarragon. This is publishing by Dr. Winston Craig. Dr. Winston Craig is a nutritionist from Andrews University, and he has a book that refer all of these effects of terpenoids and other antioxidants against cancer. So if you want to make the famous Dr. Dos Santos famous lemongrass tea, you have to smash a leaf and pour 1 cup of water and cover and wait for 10 minutes. And then we have, or if you have dry leaves, you can boil them for 10 minutes also. I used to have a garden in Loma Linda in my office, and we used to cultivate this herb. I have in my garden in where I live in Redlands, I still have some plants of lemongrass because it's good. Lemongrass is good for digestion, is good for the immune system, as we know, is good for relaxation, for sleep. So it's a very multiple effect herbal. I don't like the name of it because the name in scientific name is Cymbopogon citratus. Oh, well, I don't know who invented that name, but maybe the researcher was not feeling well on that time. But anyways, this is also something that we could use in our as a beverage instead of using coffee and other substances. In the Adventist Health Study 1, we found these foods that are protective against cancer, and then depends on the cancer, we have the ones that are hazardous or increase the risk. So in colorectal cancer, we found that beans are protective, and meat was increase the risk of cancer. This is also matched by the World Research Cancer Institute, because our program here is based on the World Cancer Research Fund, and it's World Cancer Research Fund and American Institute for Cancer Research. Those are the two entities that produced that book that I advised in the beginning of the course. But this is matching because colon cancer is still related to high, or prevented by a high intake of fiber. Remember, we talked about Dr. Burkitt, went to Africa and figured out that fiber is a prevention method against colon cancer, and still valid, and still approved today. And we know that meat and animal fat and processed meats will increase the risk of colon cancer. Fruits were protective for lung cancer. Again, this is also confirmed by the current literature. Fruits are protective against stomach cancer, is not very well confirmed. And then legumes and vegetable proteins and dry fruits protect against pancreas cancer. In the literature, we didn't find that. Meat increased the risk of bladder cancer. We didn't find that. And then prostate cancer, legumes, fiber, tomatoes, nuts, and dried fruits protect. This has not been confirmed in the normal literature, in the general literature. And then fish and meat increase the risk of prostate cancer. Meat may be a saturated fat, but not fish. The Adventist Health Study 1 was a small study. They have 30,000 people, not that small, but we didn't have much cases of cancer. So when we have a small sample size or a small number of people participating with cancers, we cannot derive much results from that. We believe that in the Advanced Health Study 2, we will measure all of these elements again, and then we will have a better result to see what are the foods that really relate to cancer. In the Advanced Health Study, however, we were sure that tomato protects against prostate cancer and ovary cancer, and soy milk protects against prostate cancer. We know, let's go back to the cruciferous vegetables. They contain isothiocyanates. So those are enzymes that activate the elimination of carcinogens. And those are the family of the cabbage, as I mentioned before. And the reason that they are called cruciferous is because their name came from crus, that means a cross. And then when we check the flowers of these vegetables, they have all the format of a cross. So it's a very blessed type of foods. Isothiocyanates in rats in the lab, they were effective to decrease esophagus cancer because they block the cytochrome P450. And we know also that quercetin is able to block the same enzyme that increases the risk of cancer. And then quercetin is found mostly in apples and onions. So how about chili or pepper? There is no evidence that chili or pepper has effect on cancer. Some suspicion were that it could cause stomach cancer, as chili or pepper can increase the risk of ulcers. And those ulcers are related somehow to the precursors to stomach cancer. So chili could increase the inflammation of the stomach, and but there is no much evidence to prove that. I don't advise chili or pepper in the amount that many people use, that is very spicy. I think a little bit and not daily would be okay. There is some evidence that chili or chili pepper could protect against bladder cancer, but this is also not proved to be true. In laboratory rats, they found that isothiocyanates found in the cruciferous vegetables are able to decrease esophagus cancer, and because they block the cytochrome P450. And quercetin also can block that enzyme, and quercetin is found in apples and onions. There is an evidence that red meat might increase the iron ingestion, and iron is a free radical that will damage by oxidation of the DNA and increase the risk for colorectal cancer and probably liver cancer too. So that's one more reason to avoid red meat. Red and processed meat might activate the enzyme, again, CYP450, that increase the risk of colorectal cancer. According to Dr. Daphne, I got this from a presentation that she did in 2007 in the International Vegetarian Congress in Loma Linda. She said that according to her studies, red meat is related to mouth, pharynx, lungs, stomach, pancreas, colorectal, breast, uterus, lymphoma, non-Hodgkin lymphoma. You can remember Cindy. We put a diet that was no meats on that diet in order to recover from the lymphoma that she had, and she did a good job on that. Processed meats, this is the new thing. I mean, we are figuring it out now, and it looks like the World Health Organization is recognizing that processed meats increase the risk of cancer. And according to Daphne, increase the risk of mouth, pharynx, nasopharynx, larynx, esophagus, stomach, pancreas, colorectal, breast, prostate, and brain in adults and children. If the mother ingests the processed meat during pregnancy. We know for sure that the risk of esophagus and stomach cancer, and if I am not wrong, colorectal cancer, are confirmed. And so is something that more and more processed meats should be avoided because of the presence of nitrates, and nitrates will increase the amount of nitrosamines, and nitrosamines are cancer promoters, and then not advised for health. All meats increase the risk of cancers in lung, pancreas, liver, colorectal, breast, ovary, uterus, prostate, and kidneys. Again, this is by Dr. Daphne that she presented during the conference. How to protect your child against cancer? There is something about calories in childhood. For each increase of 238 calories in childhood, there is 20% higher mortality for cancer when this child will reach adult life. Less calories in childhood will decrease the risk of breast, prostate, and colon cancer when the child gets to adult age. High consumption of fruits in childhood will decrease by 38% the risk of cancer in adulthood. So that's a very good thing, very simple thing to do. Avoid junk food during childhood, and avoid the excessive or empty calorie food, mostly rich in sugar and protein and refined carbohydrates, and use more fruits, please. Can diet changes affect cancer patients? We know now for cancer survival that saturated fat in women with cancer promotes more rapid spread of the cancer. High fruit and vegetable intake improves cancer survival. Fiber, fruits, and vegetables also prolong life in patients with prostate cancer. So this was by Dr. Ornish, as I mentioned in the past. So again, a more plant diet is better. What are the summary that we can finish this program here talking about cancer that the World Cancer Research Fund International they found. This is a summary. We already talked to these individually when we talk about those types of cancers. But we know for sure that fiber decreases the risk of colorectal cancer. Non-starchy vegetables decrease the risk of oral, pharynx, and larynx cancers. Garlic is related to less colorectal cancer. Fruits might be benefit to decrease the risk of oral, larynx, pharynx, and lung cancer. High calcium diets will be benefited to colorectal cancer. And then breastfeeding decrease the risk of premenopausal and postmenopausal breast cancer. Coffee decrease the risk of liver and ovary cancer. Exercise decrease the risk of colorectal, postmenopausal breast cancer, and uterus cancer. Then the ones that increase the risk, aflatoxins increase the risk of liver cancer. Those are the toxins produced by Aspergillus, a fungus that can live in grains that are rancid. Red meat increase the risk of colorectal cancer. Processed meats increase the risk of stomach and colorectal cancer. That's what we mentioned a few slides before. that it can produce nitrosamines and increase the risk. Also can increase the risk of esophagus and oral cancer, but the evidences are not as strong as the stomach and colorectal. Salted fish and foods rich in salt might increase the risk of nasopharynx cancer. This is common in Hong Kong, related to the salted fish that they use there, and also stomach cancer. Glycemic load, using too much sugar or refined carbohydrates, increase the risk of uterus cancer. Arsenic in the water can increase the risk of lung, bladder, and skin cancer. Mate, the chimarrão used in South America, in my country, south of Brazil, Argentina, and Uruguay, increase the risk of esophagus cancer. Remember, it's not just because of the burning, but because of the production and the drying of the mate leaves that produce benzopyrene, that are the same substance found in cigarette smoking. Great birth weight, so a child that is born with a great birth weight will increase the risk of breast and premenopausal breast cancer. Alcohol, the big villain here, increase the risk of mouth, larynx, pharynx, esophagus, stomach, liver, colorectal, and breast cancer. Beta-carotene pills increase the risk of lung. Body fatness, being fat, overweight, and obese, increase the risk of esophagus, stomach, pancreas, gallbladder, liver, colorectal, breast, ovary, uterus, prostate, and kidney. And then adult height, increase the risk of pancreas, colorectal, breast, ovary, prostate, and kidney. Again, I compare the adult height with the same that we mentioned about body fatness, because it depends on what kind of substance, what kind of food, what kind of diet was given to the child, and even during the pregnancy, what kind of diet the mother was using. This all can affect the height in a proportion that the child will grow too fast, and then will increase insulin, will increase estrogen, will increase a series of hormones that are cancer agents. Okay, you cannot do much about height, because height is height. You cannot change the height. But you can do a little bit about that. I mean, educating pregnant women and educating families that they don't give the junk food to their kids, because the risk of cancer will be increased if they do so. If we finish this slide, we see that the two main villains here are alcohol and body fatness. Of course, here we don't have smoking, because this smoking is not a food. We are talking mostly about food and the risk of cancer, food and exercise and the risk of cancer in this table here. But if we have to summarize the three main risk factors for cancer today: smoking, second, being fat, third, drinking alcohol. I will finish with a story from my mother. My mother, I was working in Hong Kong, and she was in Brazil, and then she was diagnosed with breast cancer. When she was old, and then she said, what should I do, Hildemar? Hildemar is my first name. And then I told her, well, do whatever the doctor says, but I will prescribe the diet, okay? Okay, she responded. And what will that be? What kind of diet? And I said, well, the healing diet, the detox diet, lots of fruits and vegetables, whole grains, legumes, roots, nuts, seeds, all natural. Oh, that will be wonderful. And then, wait a minute, Mom, let me finish, I said. Now I need to tell you what not to eat. No meat, no chicken, no fish, no eggs, no milk, no cheese, no sugar, no sweets, no fat, no oil, no white rice, no white bread, no pepper, no vinegar, no alcohol, no coffee, no soft drinks, no ice cream, and lots of fun. What? But she followed the diet exactly as I told her. And she went to the surgery, she removed one breast, she did chemotherapy, did not lose any hair, didn't feel much pain, had a rapid recovery. And then 7 years after the surgery, she is okay. She does not have anything. She was in perfect health. And this, when I put this in the slide, she was 83. Now I just visit her in 2017, and she was 94 years old and no signs of cancer anymore. She even visited us in Hong Kong, and I found a boyfriend for her, Chinese boyfriend. Just a joke. This is the Wax Museum in Hong Kong, okay? So if I have to summarize what are the elements of a cancer protective lifestyle for cancer patients, for people that have a high risk of cancer, for those that have a family history of cancer. The diet should be more plant-based diet, better if it is a vegan diet, total vegetarian diet. It should be rich in fruits and vegetables. Even if you use animal food, the main type of foods is fruits, vegetables, and beans. Less animals, avoid junk food as much as you can. Use herbal seasonings, drink plenty of water, avoid smoking and alcohol, avoid molded food. It sounds reasonable to me. Avoid fat, barbecued, charred, smoked meats. Practice exercise every day, at least by 30 minutes. Maintain proper weight. I would say maintain proper height. You cannot do anything about your height, but you can do something about your weight. Sunlight in moderation. Use a hat. Do frequent medical checkups and control your stress. The recommendations given by the World Cancer Research Fund and American Institute for Cancer Research are similar to what I did, but not as complete as mine, because they are based strictly on their prescription, on the evidences, and I respect the evidence, but we put a little more on the health traditions of the Seventh-day Adventists and some things about the mechanisms that we have from the vegetables and from the fruits that are probably anti-cancer. So their advice: be as lean as possible, be physically active 30 minutes per day, avoid sugary drinks or energy-dense foods, eat a variety of fruits and vegetables, whole grains and beans. I'm happy that they put beans on that part, because beans are the main thing. They call me in Loma Linda Dr. Bean, because I promote beans in every single lecture that I give. Limit the consumption of red meats, beef, pork, and lamb, and processed meats. Limit alcohol drinks, or consider not to drink it. Limit salty foods and processed with salt. Do not use supplements to protect against cancer. Breastfeed for at least 6 months. And after treatment, cancer survivors should follow recommendations for cancer prevention. I will finish with another story here. I used to have a mentor when I came to Loma Linda in 1994. And then he was a healthy person. He has a good diet, vegetarian, no meats, lots of vegetables. He used to exercise, never smoke, never drink, had a good lifestyle, and was a very bright professor, no doubts. However, he used to have a lot of stress. He used to teach a lot of class and do research, and then has a lot of trips to talk about health and write papers and revising papers. Has an administrative position, a member of a number of committees. He didn't have time for anything. What happened? He was diagnosed with colon cancer and died 1 year after their diagnosis, his diagnosis. I put that, RIP. Finally, he was able to control his stress. So we talk a lot about foods, exercise, and other chemicals and smoking, on alcohol, on the effect, on their effect on cancer. But maybe stress, emotions, depression, anxiety might have a strong effect on the cancer cells also. And I believe a strong effect on our immune system, suppressing it, then we cannot fight against cancer and the cancer go free. I will finish this chapter with a message that who believe in him should not perish, but have eternal life. So this is a message for all, that even with cancer in this earth, one day we will go to a world without cancer. Thank you. I will see you in the next chapter of the Cancer Prevention Seminar.